welcome back. And of course, as was mentioned earlier in the show, the focus of this conversation is on World Health Day 2015. Joining us for this conversation is Dr. Jorge Polanco, the non-communicable diseases focal point at PAHO and the coordinator of INCAP. We're joined by Dr. Miguel Figueroa, Director of Food Safety Services at BAHA, and John Bowden, Principal Public Health Inspector of the Ministry of Health. Good morning and welcome.
Good morning.
Now, World Health Day has a specific focus of food safety this year. Let's talk about just the general celebration before we move into specific context of Belize.
Okay, thank you very much. Today, April 7th, indeed is the classified or named as World Health Day. And what that means is that globally, every country is celebrating this day. And for this year, the topic selected was food safety. The history of the World Health Day is that it's a day that commemorates on April 7th the Constitution of the World Health Organization. So in reality, that's when the Constitution was approved, and it was decided then to have this day to celebrate health as a topic. And what happens is that every year a topic is selected, and this year food safety was selected. The truth is that over the last decade, there has been some emerging situations that have put food safety up in the forefront as a priority for the World Health Organization and PAHO. For multiple reasons. The food safety industry is a transnational issue. And there have been many outbreaks associated to traveling, many outbreaks associated to environmental sanitation, many, actually, about 200 diseases are linked directly to when food is not safe, to food safety, to foodborne illnesses. And Belize is no stranger to experiencing in the past I would say some small outbreaks, but we have had some small outbreaks. Even though you will hear from the colleagues here that in Belize there is some structures and some systems to ensure food safety. So coming back to this global context, knowing that it's an issue that has implications to tourism, has economic implications, also has a direct burden on the families and on the health systems on a whole. So it is of much priority to ensure that each country, in this case Belize, has in place and utilizes this day to create awareness, not only among consumers but even within the authorities, to ensure that the existing policies are enforced in order to guarantee that the population consumes safe food.
Now, the theme specifically is from farm to plate, make food safe. Let's talk about BAHA's role specifically, because obviously we don't always think of where the food comes from when it's placed in front of us, be it a restaurant or sometimes in your very own home.
Right. BAHA, just a bit of history. BAHA was established in the year 2000. Actually, we just celebrated the 1st of April, 15 years anniversary of BAHA. When BAHA was established, that's when the Food Safety Department was established, was developed. And it's basically was developed to attend to the export market. So especially the shrimp industry, because the shrimp, we were exporting a lot to the different countries, and one of our major country was Europe, so we had to establish a food safety department so that we could comply with all the requirements for export. So we started with the export market, and now after that we started to work with Ministry of Health, and we actually signed a memorandum of understanding with regards to some of the facilities here, local, for domestic consumption. And one of these facilities are the slaughterhouses. So we are present at the slaughterhouses. We have inspectors there conducting ante-mortem inspection and the post-mortem inspection. We have our regulations, that is the SI 23 of 2001, which gives that authority for us to inspect animals before slaughter.
And I love that you touched on that point, because that has been one of the criticisms in the past, that perhaps the focus on making sure that food is safe for export seems to be more of a priority than ensuring that the food that is consumed locally is equally as safe. What is being done to ensure that whether or not something is being sent out to another part of the world or being sold right here at a local market or at a local supermarket is of the same quality?
Well, that's where Ministry of Health comes, because a lot of the domestic market, that's where Ministry of Health becomes involved.
Yeah.
So,
okay. In reference to the quality at home being the same as being exported, in fact, what we do apply is these basic standards, the minimum standards that is acceptable for food products being produced in the country. And so when we talk about export and domestic product, the difference there might be based on, for example, with export, the market outside might have their own specification, which might be higher than the minimum standard. And so that product would have a higher quality because of the destination that it's going to. But basically, all food produced in the country is expected to meet the minimum standards.
Now, as we're talking about domestic consumption especially, we're still, I think it was last year, we had leptospirosis and that being an issue. And we know that we still don't have a ranking, for example, for restaurants to say whether they're A, B, C, or D in terms of their practices. We know that we do have a health workers permit. Food handlers permit, sorry. Food handlers permit. But beyond that, are we going to see strides to make those things more a part of what we can expect locally when we are faced with food safety as a major issue?
Okay. In 2008, the Ministry of Health embarked on a program for improving the food safety program of the Ministry of Health. And the first aspect of that program was to do the certification of those people involved in food safety industry. That basically meant that these people now would be undertaking a new procedure for training and building their capacity to actually practice good skills when they're dealing with food. So that was the first aspect. It has been, 7 years now, because that program actually started on the 1st of May 2008. And what we are about now to do is to go on to the second tier of that system, which is the certification of food establishment. Mm-hmm. So in this year, that should be rolling out. And so we'll be seeing that the food establishment will be categorized in probably three. The thought right now is in 3 categories, and that would indicate the level or the status of the facility in terms of meeting those minimum requirements.
Yeah. Now, you had mentioned the survey that was done, was it last year, on gastroenteritis?
Was the year before.
The year before, that's right. And it was very interesting because it really showed the level of illnesses that we were having as a result of several foodborne illnesses. There was the rotavirus, there were parasites, which people don't understand how disgusting or what it says about food, about hygiene practices in general. It's true, because and I know PAHO, for example, undertakes initiatives like reminding people to wash their hands, and it is some of the practices that take place within our homes that we take for granted. Salmonella, we hear a lot about in the United States. We also have cases of salmonella poisoning here as well, perhaps not as much. So while you have BAHA working at the slaughterhouse, from the portions where the food is primarily being produced, you can work with restaurants, but then what do we need to tell people about food safety within their own homes?
Well, I think when we look at food safety, we need to look at those 5 keys, and I think that has been promoted over and over what we need to do. And there are certain these precautionary measures are very basic and can be used by absolutely any person that you can think of. It doesn't matter about your social setting, because the practices that you need to do are very simple. For example, in terms of preparing probably vegetables and meat, you don't want them to be in contact with each other, so keep them apart. Use different boards. If you have to use the same board, you need to wash it or disinfect it before you reuse it for a different purpose. Cooking your food thoroughly. And I don't believe that this is a problem in Belize. In fact, sometimes I think that we overcook our food. And that has another implication, because when you talk about food safety, you also talk about nutritional security as well. And if you overprocess your food, what you have then is bulk, which means that it does not have any nutrient. It just goes in your body and it doesn't do anything for you. And of course, that's of no benefit when you're eating, because you eat for a purpose, to get some nutrients into your body so that you could survive. We talk about keep everything clean. That's the number one thing. You must ensure that you keep things very clean. You need to store your food products at the specific temperature required for the product. Hot foods hot, cold foods cold. In fact, I think when we look at the street vendors itself, the industry is moving now. Once before, we used to see people just take out food in the ambient temperature and just leave it there for hours. Now we're seeing people making the necessary changes that we're recommending. For example, you keep food hot. So now you find a lot of people have little warmers out on the street sides, or you have people having ice boxes and these sort of things.
Or the separation of who handles money and who handles
exactly.
food. Which is
well, that is still a big issue we are addressing, but we are seeing that the changes are being made. And so when we look at all these different measures that need to be applied to your food processing activity, it is very simple and cheap. It can be done by almost anybody.
What would you say is one of the most common mistakes that we culturally tend to make that disregards what is best for our health?
I think the temperature control is one of the mechanisms that we always overlook. And
temperature control for storage?
For storage.
Okay.
Because notwithstanding you have it exposed, it needs to be in a certain environment. It does not make a difference if it's a long time storage or a temporary storage. There's not a difference. The food must be contained at a certain temperature.
So like poultry, for example, is one that people are very wary about, whether you take out your chicken to defrost or you put it in the fridge and defrost. Or whether or not it's cooked thoroughly as well is also of utmost importance. And people are obviously very fearful of turkey as well. So is that what you're referring to when it comes to storage?
Definitely. For example, one of the practices that we're still struggling with is maintaining salads in ambient temperature, especially the potato salad. It doesn't matter so much with green salads, but the potato salad, if you make it, because the ingredients inside is milk base, and because of those milk-based products, for example, you got a milk byproduct, you have mayonnaise, you have salad cream, you have the milk itself. I mean, that is a product that is a disaster ready to occur. Yeah. And so you need to ensure that if you have it open, it should be what is called an ice bath. So you'd have a container filled with ice, and that salad should sit on that. And it cannot be too deep, because just yesterday, I think I drove down Freetown Road and somebody had a huge tub of salad about that big. But because it's so deep, the temperature would not be able to penetrate that amount. So it has to be in small quantities as well. So those are little things that can make...
So while they're trying, they're still not necessarily achieving what they're trying to do with safety.
I think to strengthen public education, and that is something that we need to work on.
But let me just pull back to a second, because very often when we have the World Health Day and there's a theme, somehow people figure that we've solved a problem. Let's say last year it was vector control that was the major focus. Have we moved beyond those things, and what's the main purpose by choosing a theme? Is it kind of shifting our attention to say this is also an issue, but we can forget about what we did last year?
Not really. The truth is that they are different areas, and the idea is to use opportunities to focus on all areas as much as possible. It's true that World Health Day is only once a year, but during the year you have other events, other health days that could be specific. For example, speaking on vector control, there is a specific Malaria Day. There is a specific World Food Day. It's on October 14th. So again, on October, that will be highlighted, and in between, you would have other days where subtopics could be shared. So it's just once a year. Throughout the year, there would be opportunities. The Ministry of Health and PAHO and BAHA would also make use of any opportunity to increase awareness, which brings us back to to the point that you brought up, the issue of public education, or Dr. Fig brought up, public information. I just want to say here, in regards to what Mr. Boone was saying, the issue of temperature, that Belize has that habit, has that custom of cooking food very good. And as a colleague said a few weeks ago, perhaps that is one key factor that could explain why Belize suffers little outbreaks of foodborne problems. What goes with that is that there are other factors that contribute to food safety, to foodborne illnesses, and as I said earlier, the issue of environmental sanitation, that's there. Of course, cooking the food good will take care of those things, but the truth is that it is necessary, and one strategy is the hand washing. So simple and could be done by everybody, but it needs to be taught, and I know it's being taught at schools. Within the environment, we have, when you made reference to the parasites, well, are the causes, are the organisms responsible for contaminating food. But in this case, when you made reference, and that was in reference to the causes of diarrhea in that study, which parasite was the leading cause. What that means, and this is the point I want to bring up, is that the environment is such that people get contaminated, eat or drink something contaminated, and get infested with parasites. In simple words, that was the leading cause, as the responsible organism. Now, this is of importance because there was a study, it's a few years ago, was it 2006, Mr. John? The study done on the parasites on schools.
Yeah, 2006.
Somewhere around 2006, a study was done where in certain areas of the country, in school children, and it was alarming to find that there were some schools that had as much as 62% of infection, all types, mild, moderate, and severe. So that's a lot. That's 6 out of every 10 children were infected.
And that's part of why, because some of it is fundamentals. It's knowing, yes, you should store milk-based foods properly, wash your hands properly before you eat, after the bathroom. You know, all of these things are paramount to ensuring that we don't get sick. But I want to ask a question, because so often we're so dismissive of any kind of stomach issue that we may have, and that's what Belizeans call it, bad belly, no? And that could be your diarrhea, your vomiting, your cramping. I don't know what other symptoms we could mention, but you know, it's taken so lightly. Take an Alka-Seltzer, or take some Tums, or drink a hot Coke, and you know, it will wear off.
Lime.
Or some lime, and it will wear off and it'll be fine. Now, what are the implications of having such frequent outbursts of foodborne illnesses, or any kind of bad belly, as we see for Belizeans?
Okay, I think I want to address the first part that you had mentioned in terms of acknowledging that something is wrong with you and visiting the doctor, because that is one of our biggest problems that we have here. I think that we have milder cases of food outbreaks in this country, and because it's mild, people believe that they can do self-treatment, which is not normally advisable, because you need to know what is wrong with you if you're supposed to treat yourself, because it might be just temporary relief, but the problem would persist. And so even when we look at our BOI, which was a BOI study, the burden of illness study as it relates to acute gastroenteritis, we identified that people were reluctant to even provide a specimen. Why? We know the reason behind, because people do not like to associate themselves with handling of excrement or feces. And so people normally, when they would visit the doctor, would say, provide us a sample so that we can test it and see what exactly is within the specimen. It's normally not done. People would visit the doctor and they go home and that's it. They already received the treatment. So that, of course, would tend to probably reduce.
So there's an unwillingness for people to provide stool samples. Is that what you're saying?
In most cases, the doctors would order it, but the persons would never turn up at the lab.
And that is the only way you can identify what kind of parasites or virus or...
There are several things that you need to connect here, and it must be done. And that's the reason why we have BAHA, because in terms of looking at circulation of a certain pathogen within the environment, you need to understand, first of all, what is circulating in the environment, which you can detect in the food specimen itself. So that can be done at BAHA's lab, and we collaborate with that, and we would do that sort of activity. The second component is isolation of the pathogen within the person's stool sample, which would then correlate. Is it the same thing that we're seeing in both? Are they related? Is it being contributed by a specific product? And so that's where it's important to draw that connection to see if we're talking the same things. Because I know most people, when you talk about salmonella, everybody thinks about chicken. But salmonella has over 200 strains. Over 200. And in almost every single product you can find it. So if you even have one isolated in a food sample, and you have one isolated in the human specimen, it does not necessarily mean it's the one and the same, because when you do the typing of that salmonella, you might end up with two different types, which does not correlate and make you...
Let me just ask something, because one of the things is that we don't focus a lot on is personal responsibility in terms of guaranteeing your own safety, like whether people choose to go to a vendor middle night to go consume, rice and beans with chicken and salad because that's what they normally eat. And we're talking about public education, about making safe choices or looking for certain things. So what are some of the things that people should be paying attention to if they do go and consume food from a street side vendor? I mean, some people look at it like for tacos, like whether they're washing their hands, and there are no bathrooms around. So that's not going to happen.
Water is not enough.
Right.
Okay, one of the, I like to, because in terms of our training, we normally advise people that presentation is the first thing that you look at. So when you look at an individual, if the person is unkept, that says a lot about you. It's not only about myself that I'm unkept, but it speaks about my environment in which I will produce the food probably will be unkept, and the food will not be managed properly. So that is the number one clue that maybe the source of that food is not a safe source, and you should then decide to walk away and buy from somewhere else. Again, even in terms of approaching that vendor, you should take a general observation of what is happening with the food itself. Is it being properly managed? Is it being kept at the appropriate temperature? The utensils being used are clean and single utensils for every different food. Those are basic things, because that's where you could have cross-contamination. And you have to be very careful, because sometimes if one product is already spoiled and you start introducing that same utensil for the others, then you have spoilage because of the cross-contamination occurring. So that's I think the second thing that you need to look at. And of course, I know most people don't ask for it, but the permit should always be in the possession of the food handler. And if you ask them, can I see it? They should be able to present that to you.
So your hot dog vendor should have that?
Everybody that deals with food will have one, or should have one. And they should be able to produce that. And normally, people who goes to the extent to have that with them normally knows exactly what they're doing, because they've been through the training and they know exactly what needs to be done in terms of food preparation. And so you have that responsibility to ask the person, can you show me? Because when we visit them, we ask them for the card to be presented.
Yeah.
It's the passport, like a passport.
And that's where your shared responsibility comes in, that we need to be enforcers as well. But one of the common things Belizeans will say is, well, we got junk or stomach. We stomach just about anything.
I think that's a misnomer. It's not that we have probably junk or stomach. Maybe a few of us do. But because of the preparation of food in this country,
we are immune.
We prepare thoroughly cooked food, as opposed to many other countries where you have the medium rare and it thoroughly cooked. So when you go to other countries, you need to tell them exactly what you want. In Belize, even if you ask for medium rare, you can't get it, or it's over processed. So we are not from that culture.
Yeah.
And so what we have prepared for us is normally thoroughly cooked food. And so you will not have that sort of issue with it.
But could it also be that we have been exposed to many of the different pathogens already?
And,
possibility.
And I want to jump on that, because I was actually reading something online where they're talking about in some developing countries, they're looking at outbreaks because people use Clorox and this to clean and kill everything, that children are now, they're finding out that a lot of the children are getting sick for everything because
they haven't been exposed.
Right, they haven't been exposed to anything at all. So how do you strike that balance between the two? Because I know in the US there's even a mild bleach that is used on all vegetables to clean it, and you're encouraged to use it within your home. You know, and then we use Clorox, and even in Belize, people use Clorox to clean everything and stuff. But we're not as ambitious as some people are in developed countries.
We have, for example, there's a country, as you mentioned, in Europe, it's Ireland. They are free of salmonella in chicken. There's no salmonella in poultry. So if you want to export to Ireland, you have to show that your country is completely free of salmonella, and that's impossible, you know. So, and if they ever get exposed to salmonella, they will definitely get, you know, full-blown sickness, illness, because they don't have that immunity. They are free of that. So, if, as I said, if we want to export poultry products, any country wants to export, they have to show that they are completely free of salmonella.
I think when we talk about immunity, and that's what we're speaking about, when you're exposed to certain bacteria, viruses, there's a certain level of immunity, but it's not total, because it relates to the amount of load that the body receives. You receive 1, 2, 3, maybe 100, your body can actually handle that situation. It's when you're talking the load in excess, millions, and bacteria and viruses, they multiply so fast. I mean, and that's why when you prepare food, you should not keep it longer than 2 hours outside in the ambient temperature. It should either be kept hot or cold.
But our culture says food have to cool before you put it in the fridge.
And that is not a good practice.
Can you address that, please? Because we've had even chefs come on to try to tell people otherwise.
Well, there's an issue there where you could affect the equipment in terms of putting extremely hot food.
Yeah.
It's not extremely hot food, but you need to cool it a little before you put it into the refrigerator. But all food should be kept at controlled temperature. And that's the reason why in the developed countries you see food, even though it's exposed, it's normally in a what you call a cooling table, where the food is kept chill. And if it's supposed to be hot, then it's piping hot. It's either hot or cold. But in Belize, we tend to be very loose in terms, and I guess it goes back to our immune system, how it responds to the viruses that are bacteria that are in circulation, the pathogens itself.
Yeah.
So I think that kind of put us to be very loose in terms of what we do and how we do things in relation to food.
Now, I want to pull back, because we've spent a lot of this conversation really looking at what we're going to put on our plates. but from that perspective, not necessarily going all the way back to at the farm level. At one point we had conversations about what kind of fertilizers are being used, what kind of insecticides are being used, and those are a part of the conversation, but we don't necessarily see those anymore. And we're not a country that where people are willing to pay more for organic food, or it's required that they're labeled that way as well. Should that be something as well that we are paying attention to, and is that Baha's responsibility, or whose responsibility is that?
The farm level, it's Baha's responsibility. The farm, for example, chickens, before it goes to slaughter, you have to have that withdrawal period. So the inspector does actually go to the farm, and they have a chart. All barns, they have a chart, and they find out what medication they have been using. And they have to present that to the inspector prior to allowing it to go to slaughter. So that's one of it. With regards to the vegetables, we are still working with that. We have a project right now with Taiwan, that we will be monitoring residues, chemical residues, the pesticides and what's not, that they are using, and the time that, see if they are following that pre-harvest period, if they are adhering to it. And we will be doing that. It's a 2-year project that will start sometime this year. That's also to ensure that whatever vegetable is at the retail shops, they are free of pesticides.
Now, and I ask that particular question because very often people like to say, oh, everything in Belize is grown organic. Is it?
Well, that chuckle definitely said no.
No, I think, no, I'm raising that point because we take a lot for granted that things aren't being put onto foods that, you know, are unsafe. Whether it's the insecticide use and the duration, even chickens. I mean, we don't think about hormones being used in our chickens, etc., and whether there's a drying out period to make it safe for consumption. Are those concerns that we should have as we look at food safety?
Actually, they are concerns, William, and I think we have been doing some activities or interventions to ensure that these things improve. The same program he was speaking about in relation to the Taiwanese project in terms with farmers and vegetables, it's going into its second phase because last year we did work with about 20 farmers to improve the outcome of the vegetables on the market itself.
Actually, to manage the pesticides, that was one of the
yes, and even to look at their personal health as it relates to intoxication with pesticides. So we did that already. That first tier concluded. We're now at the second round, where we look at including some additional farmers in terms of ensuring that there are good practices associated with production of vegetables, which include looking at pesticide use in the farms.
Yeah.
So we are doing that sort of thing.
And I think that's an excellent point to take a look at food safety in terms of the long-term impact on health. And that's one of the things I want to bring you in for, Dr. Polanco, because the focus on nutrition, it's very eye-opening when you talk about the fact that overcooked food is therefore not as nutritious as we need, not as nutritious as we think it is when we consume it. Looking at some of the issues that we know exist in our countries, the NCDs obviously, and specifically some of the cancer that we see happening quite often. There's very little information in terms of why our society faces the health challenges that it does. Does this have a part to do with it?
Well, the answer is yes, because when we speak on food safety, we are not only referring to the presence or absence of organisms, contaminating organisms. We are also referring to safe food for the purposes of one's nutrition. And we have the concept that we call food security, which goes in line with that complements food safety. And when we speak on food security, we're referring to individuals or communities having the appropriate food for them to have a good nutrition. I must say that food safety is also linked to diarrheas, other gastrointestinal infections, and as far as some cancers also, especially, and that is linked to the presence of pesticides or other metals. In Belize, we have put a lot of attention to the preparation of food and the quality of food, especially over the recent years, to ensure that that when we speak of food security, everybody has access to proper food. I must say in this line, in regards to processed food that you mentioned, and on let us say fruits and vegetables, there is a need to create more awareness that even vegetables, they will be eaten raw. You comply with the 5 steps to keep food safe. Washing them should contribute to reduce the possibilities for infection. I must also say at this time that the experience in Belize, I believe the quality of water that is used by the population is such that has contributed to keep foodborne diseases at a very low prevalence. I think there's not a village that does not drink some small quantities of bottled water, and especially the urban areas, I would say. If I should make a guess, I believe the majority would have access to. And for the purposes of preparing food, they use the tap water, which we know the tap water, there is a good structure in the country to guarantee safe, to guarantee potable water. So having potable water in every village, because if they don't have the pipe water, they have the rudimentary water systems, which are also treated and managed by the water boards under the Ministry of Local Government. So then that in itself contributes to reducing foodborne problems.
Now, let me just jump down one other road, because when we're talking about, I want to go back to the whole. We go to the market and we assume that food there is safe. Is it? And how can we, because we're talking about education as well. You go and you're buying your vegetables, etc. What can you do to ensure that it is safe, other than just looking at it and saying this is good or not good? And when you're talking about the quality of it, but not necessarily knowing whether insecticides or where it comes from.
I think when and probably Dr. Fink could probably expand on that, but I think very often we are not familiar with systems in place in the country or what a certain sector is doing. And when we look at the Ministry of Agriculture and their extension officers, they actually visit these farms and to ensure and the other to ensure that they actually have withdrawal periods. And this is also done by the Pesticide Control Board. And these are practices that needs to be adhered to, and they monitor these farmers to ensure that the necessary withdrawal period, they're actually adhered to. So there are systems in place. It does not mean that now when you get to the market that all those people have been actually assessed and evaluated to ensure that these products on the market, because there's a lot of contrabands that are happening, and even when they do assessments at the market, normally you would find out that certain products looks very different. In fact, the pink potatoes that we had just
that was a
just
great
recently,
example. Yeah.
It shows you that how people evade systems.
Yeah.
And
but it
so,
also shows that people have their own self-monitoring that's taking
Exactly.
place, because they saw
something
what
different.
looked very different from what the natural product was,
Exactly.
and raised the alarm. So I guess it goes back to our own responsibility.
Exactly, that's what I was going at. Because personally, if I go to a meat shop, for example, I want to know, where did you get your meat? I ask. Or to a restaurant, where do you get your, if I'm ordering a rice and beans with chicken, I want to know where that chicken came from. And I will always ask before I eat. If I know it's under a system that is being monitored, by all means I will take it. But if I don't know the source, then I will probably.
But globally, even you're starting to see people move away to what they call free-range chicken, or you know, and we may have yard chicken. And I know even in Lidville, where I am, there are people who are selling products like that, but there's not a stamp of approval to say that this is, you know, safe, or this is being raised under conditions,
or being inspected and passed, or something
well,
like that.
Your local
something
chicken
like a USDA
local
stamp, you know, saying passed and inspected, you know. We started something like that a couple of years back, but apparently the sticker was not holding when it gets frozen, and then the sticker was moving. But we're looking into that as well, especially with that project with the fruits and vegetable, is to add on a sticker there that will tell people, you know, that this product is safe and it has gone through a process that will guarantee the safety of
I think when, in terms of what you're focusing on, I think we're talking about getting to that level where there's a recall system, because in terms of having a recall system, that's where you can validate the origin of these animals, what has been done. And I think there's a lot to be done within that area, and specifically when we look at other countries, for example, Uruguay, that actually produces a lot of beef, they can actually go back to see where that piece of beef that came from which animal specifically, and what part of the. So there is a good recall mechanism to track down the processes that occurred with that meat from the time that animal was slaughtered until it got to your plate. They can tell you exactly where that meat came from and how it was reared and the husbandry practice and all that.
Mr. Boda, I mean, there exists also here in Belize, for example, running Dublin. They have a traceability system. You can look at the
but
code.
It's based on their own initiative.
Right. It's limited, exactly. It's based on their.
But you see, that's an important point to raise, in that if people know that information and they want to be active and support a business who takes on an initiative like that, even if you have to pay more, because that's what the US has done with Whole Foods or organic labeling or whatever, to a large extent, that they reward people because you pay a bit more, but you know you're safer and you're not going to end up in the hospital for whatever reason.
I guess that would be targeted towards a selected market, because generally people look for cost effectiveness more than anything else. But I love what you talked about with the food recall, because that was one of the things we saw with the recent food recall with the Bluebell and the Kraft. I was fascinated. Kraft could identify down to the product line, so you knew exactly what to look for, versus Bluebell, who just did a general recall of all products because they didn't have the specifications as obviously a larger company like Kraft. So we are working towards having that type of traceability, to have it legislated, I should say.
There is that mechanism in the new food law that is about to be passed.
Okay.
So that would be a new activity that most people would need to take into consideration when they're producing a product now. And it does not mean that you have to have this elaborate, sophisticated system to do a recall procedure, but you do need to have a lot of documentation to identify where these products have been and what sort of activities have been associated with the product itself. A little bit time consuming, but it's worth the while.
Now, what do people do? Because I think also we don't have a process of reporting if we've received a bad food product. If I get a tray of eggs and half of them are bad, I just dump them away. Maybe I take them back to the shop for a refund or an exchange. My mother the other day bought a pack of locally produced and packaged rice that was full of bugs. And what she did was throw it away. But we don't necessarily report it. Is that something that we should do as consumers as well, to ensure that even though there's not the recall system in place, that something is done to investigate further?
That is what we recommend from the Ministry of Health. And actually, if there is a problem with any product, you should report it to us so that we investigate. For example, when you spoke about that rice, the issue with having weevil in it is an issue of temperature control, because the eggs would be there, but under the right temperature, they will develop. And so if you have it stored in a hot place, you will expect that in a very short time you would have issues like that, weevil.
But are we handicapped by things like not necessarily having an expiration date on all our products, or storage conditions being enforced, you know, in certain shops,
in the stores,
etc.
yeah. You're talking about retailers and wholesalers.
Yeah, because you don't know, for example, when you go, if I'm going to buy bread, I want to know, I'll ask, when did this bread come?
Oh no, we have our touch process. If it's soft, it's fresh. If it's stiff, it's old.
You know, but I'm saying that we don't have are we handicapped by the absence of some of those things by retailers, for example?
I think to a certain extent, but when you study public health, you realize that some of the basic things that you do have surpass those stamp dates on the product. And there is still a lot of debate on whether, and if you go and you look at Codex Alimentarius now, right now as we speak, the issue on the table is what does the expiry date means as it relates to a product. But those same things, and what we call organoleptic techniques, seeing, touching, feeling,
using your
smelling,
common sense,
are the basic things that you can do to guarantee safety. And those things, everybody has it, unless you're disabled in some form or the other. But those are things that you can use your organoleptic techniques, you know, because it guarantees, in most cases, unless there's something otherwise that would not.
Another example is if you go to a retail shop and you see eggs stored at room temperature, I don't want to buy those eggs. I want to go at least buy some that is refrigerated, that is on the maybe at Save-You
or
or
if you go to the poultry refrigerator and everything is defrosted, then you should be concerned. It wouldn't necessarily be a safe place to purchase.
Right.
Definitely.
Unless we get people
we can talk about
overwhelmed.
this all day. There's one thing I wanted to bring up though, and I might, you may very well correct me on this issue. And it goes back to the issue of NCDs and specifically cancer. Some of the things that we hear within the country are things that are continued to be, that are practiced, that could potentially be linked to some of the cancers that we're seeing. And one of them specifically that has always concerned me is, two I should say. One is the barbecue, because of the coal that is used and the burning of the meat itself, and that may have some health implications. And secondly, our beloved fried chicken, or fries from the fried chicken, and the use of reusing oil and that mixture with starch. Are those valid concerns in terms of the health sector if we're talking about food safety?
Definitely. In fact,
please tell me, can I have my barbecue every single Saturday?
I'm not a physician, but I think I should leave that to Dr. Polanco, who is a physician. But
who's just smiling.
But with anything, actually, it speaks about moderation. But when we talk about barbecue, of course, there's a lot of carcinogens in there when we're talking about barbecue. The issue of having smoke infused in the meat is carcinogenic. And so if you continuously eat, of course, you would have some effect. But I thought it would have been more from the exposure of the individual making the barbecue, because I know of a case where this person actually has cancer and they're looking at it because of his occupational activity, because he does a lot of barbecue. And of course, that if it's actually infused in the chicken, obviously you know what it can do to you as an individual, exposing yourself for a prolonged period of time, making barbecue for years. Of course, it will have a negative impact on your health.
On your health.
And that goes for almost anything that you do. So we cannot it's probably one of the nicest thing to eat, number one.
I would think two, it's healthy if it doesn't have a lot of sauce and it's not fried.
We have to look at that, and I think Dr. Polanco can probably expand a little bit more on that.
This issue of the barbecue came up many years ago, maybe about 30 years ago, in relation to also with how the patties for the burgers are made. But there was at that time, no strong evidence that could associate that level of carbon to cancers of the colon. They said there was an association, but they could not really pinpoint if it was direct or if it was just something else. So, and up to now, I have not really read anything recently as to the level of carbons in the barbecue. But we do know that carbons in general would affect, but similar to what is present in those ultra-processed foods. Right? That, yes, has been linked to colon cancer. In regards to the issue with the oil and the cooking oil, well, what we know for sure is that it's no longer oil. That's just how can I call it? There is no nutrition in that oil, absolutely. Again, it has already been burned over and over. Now, the impact on that would just contain some chemicals that, like, if they are not nutritious, they are just, I would not say they are unharmful, but we cannot really pinpoint what effect it has at the level. We do know that some, what would be the word, preservatives, those, yes, have been linked to colon cancer.
Now, what do we do in terms of regulation once we are able to identify that certain foods, and then there, I mean, we have the picture of fried chicken up and people will completely disregard what we're saying because they know what it tastes like. But there are certain things that we know are affecting the health, the overall health of our population. I mean, NCDs sound, or when we talk about diabetes, cholesterol, hypertension, heart disease, cancers, these are things that people are struggling with and are causing a very heavy burden on our healthcare system and even on our productive sector. What can we do? But what can we do in terms of regulating the types of food or the availability of some of the foods that we just generally and fundamentally know don't deserve to be in our market? And I'm not talking only fried chicken. I mean, that's different. But there are some products that we know.
You go back to choice,
this
right?
Topic right now is on the desk of the region. Actually, it's on the global health desk. The issue of this type of food, which represents excess fats, bad fats, saturated fats, and trans fats, excess carbohydrates represented by the fries. That's a topic right now globally. NCDs are on the forefront, and I must say that the United Nations had a meeting last year, July, with one item on the agenda, and it was to address NCDs. One item. That has trickled down. Right now, the World Health Organizations and PAHO in CAP are pushing NCDs on the forefront, both from the perspective of healthy food. In the region, just in Central America, right now, all the ministers of health have on their agenda to address obesity and overweight. And the main strategy is to look at the quality of food. So then, discussions have already begun with different ministries, for example, Ministry of Economic Development in the region, to look at ways to control the importation of this type of food. Everybody knows it's unhealthy, so they have to find a way to see how it can be controlled. But at the same time, or parallel to that, providing information to the population saying this food, excess of this type of food is unhealthy. Because we cannot say carbohydrates and fats are bad by nature, no. But the excess, which is what happens in Belize, is what contributes directly to these diseases.
Let me just tag on one more, because this is something that bothers me, and this is really on a personal level now. Why, with children, who we recognize that children are obviously vulnerable populations. We're seeing type 2 diabetes in our children. We're seeing obesity in our children. We know the long-term effects of these type of health scenarios. Why is it allowed, or can there be a regulation in place? I really being a bit demanding here, but we see candy vendors literally arm's length from a gate. So even if the school takes the initiative to keep the vendors out who are selling just sugar, all sugar, and isn't there something that can be done to ensure that children are also allowed to make healthier choices within school and not necessarily bombarded with what is cheaper and more unhealthy?
It goes back to your first question, whether there is in existence legislation. Action can only be done when there's something to support it, and the real issue is that there's a lack of the necessary regulation to regulate an industry a sector that exists currently in the country. And so I think even in terms of taking a certain action, you need to have concrete data to inform your decision, because when you develop any sort of legislation, it must speak to what is the current situation in your country and what are really required now for you to move from where you are to wherever you want to get to. when we look at the burden of illness study that was recently done for acute gastroenteritis, we saw that it costs us at least $10.9 million of unproductive days. So it is a burden to the government then, because if somebody is not working, then it means that, and that is just to the unproductive days, but when you talk to the actual person, you're talking about $4 million. So these are significant sums of money that can be invested otherwise if you ensure that the population is kept healthy. In relation to those school vendors, I know we have done, and I think 2 years ago we started an initiative with the schools to make them a healthier environment. In fact, this year we are actually hoping that we can get off another program which looks at creating healthier environments within the schools itself. And it goes to the extent where we look at cafeteria, what is actually produced and served in cafeteria, so that we have healthier choice for people.
Yeah.
On this same note, I must share that in Central America already, that a topic has been looked by the parliaments, the different parliaments of the countries. And last year, in March, a guideline, what we call a legislative framework, was approved that has to do specifically with that, in ensuring that the children, primary, secondary, and tertiary, so children and adolescents, have access to healthy food. And at the same time ensuring that there will be policies to safeguard them from unhealthy food entering their premises. Costa Rica has already moved in that direction significantly, with legislation to ensure that they are not exposed to junk food through marketing or otherwise. I think it's within a radius of 2 blocks that those vendors cannot be, and even marketing of unhealthy food targeting children cannot be within a radius of 2 blocks from any public school or any school. Belize is signatory to that. They participated in that initiative. The document is already in the country, so I believe at any time this will come closer to the discussion of the lawmakers, and then find strategies to make it feasible in Belize.
All right. Well, gentlemen, we want to thank you all for sitting down and having a very robust and diverse conversation stemming from food safety, of course. And we hope that the commemoration of World Health Day does spark conversation on a variety of issues. Thank you very much for joining us.
Thank you. Thank you.
We're going to go ahead and take our final break, and when we come back, it'll be for a wrap. Don't go anywhere. Open your eyes. Concludes after these messages.